Here's something that might shock you. Right now, as you're watching this video, you could have a serious health condition developing in your body and feel absolutely fine. In fact, the American Heart Association found that 60% of people over 60 have significant artery blockages, but experience zero chest pain or shortness of breath until it's almost too late. Even scarier, osteoporosis can steal 30% of your bone density before you feel even the slightest ache, and by then, one small fall could change your life forever. Most people think no symptoms means no problems, but that's the dangerous myth that sends thousands of people our age to the emergency room every single day. The good news is that there are specific tests that can catch these silent killers early when they're still completely treatable, and I'm going to share the most important one at the very end, so please don't miss it. Why does this matter so much for people over 60? Because our bodies are incredibly good at adapting and compensating for problems. Your heart can work around blocked arteries for years. Your bones can thin gradually without pain. Your kidneys can lose half their function while your energy feels normal. This isn't a sign of weakness or inevitable aging. These are conditions you can prevent, treat, and even reverse if you catch them early enough. Before we dive in, I want to know how proactive you are about your health. Type 1 in the comments if you get regular checkups beyond your annual physical, or type 0 if you usually only see a doctor when something's bothering you. I read every single comment, and I'd love to know where you're starting from. Let me tell you about calcium scoring, a test most people have never heard of, but that could be the most important 15 minutes you ever spend in a medical facility. This test uses a special CT scan to measure calcium deposits in your coronary arteries, giving you a precise picture of your heart attack risk. Here's what makes this so crucial after 60. You might have perfect cholesterol numbers, normal blood pressure, and feel energetic every day, but still have significant plaque buildup that traditional tests miss completely. The calcium score catches this hidden danger. Studies show that people with high calcium scores have a 10 times greater risk of heart attack within the next 5 years, even when everything else looks normal. Getting this test is simple. You lie on a table for about 10 minutes while the scanner takes pictures of your heart. No needles, no contrast dye, no preparation required. The results give you a number, and that number tells you exactly how aggressively you need to protect your heart. If your score is 0, you can breathe easy, knowing your heart attack risk is very low. If it's elevated, you and your doctor can start proven treatments immediately before you ever feel a single symptom. Think about it this way. Would you rather find out you have heart disease while you're feeling great and can do something about it, or during a heart attack when your options become much more limited? Bone density testing reveals another silent threat that's especially dangerous for women over 60, but men aren't immune either. Osteoporosis is called the silent disease because bones can become dangerously fragile without causing any pain or obvious changes in how you feel. Here's the scary reality. After age 60, 1 in 2 women and 1 in 4 men will break a bone due to osteoporosis, and hip fractures are particularly devastating. Research shows that 20% of people who break a hip never regain their independence, and the mortality rate in the year following a hip fracture is as high as 25%. But here's the hopeful part. Bone density testing can predict fracture risk years in advance, giving you time to strengthen your bones through specific exercises, nutrition changes, and, if necessary, medications that can actually rebuild bone tissue. The test itself is quick and painless. You lie on a padded table while a scanner passes over your hip and spine, measuring how dense your bones are compared to a healthy 30-year-old. The results tell you if your bones are normal, showing early signs of thinning or already in the osteoporosis range. If you catch bone loss early, weight-bearing exercises, adequate calcium and vitamin D, and sometimes medication can not only stop further loss, but actually increase your bone density. Imagine the peace of mind of knowing your bones are strong enough to handle whatever active lifestyle you want to maintain. Your kidneys perform over 60 different functions in your body, but they're so good at their job that they can lose half their capacity before you notice anything wrong. Kidney function testing is crucial because kidney disease affects 1 in 3 adults over 60, yet most people have no idea their kidneys are struggling. The danger is that by the time you develop symptoms like swelling, fatigue, or changes in urination, your kidneys may have lost 70 to 80% of their function. At that point, you're looking at dialysis or transplant rather than simple treatments that could have prevented the progression. The good news is that kidney function testing is incredibly simple. It's just a blood test that measures creatinine levels and calculates your estimated glomerular filtration rate, which tells you exactly how well your kidneys are filtering waste from your blood. There's also a urine test that checks for protein, which is often the first sign of kidney damage. These tests should be done annually after age 60, especially if you have diabetes, high blood pressure, or a family history of kidney disease. If caught early, kidney disease can often be slowed or stopped through blood pressure control, blood sugar management, dietary changes, and specific medications that protect kidney function. The key is finding out before you feel sick. Colonoscopy screening saves lives by catching colon cancer when it's most treatable, but the timing after 60 is more critical than most people realize. Colorectal cancer is the second leading cause of cancer death in the United States, but it's also one of the most preventable. Here's what makes this screening so powerful. Most colon cancers start as small polyps that take years to become cancerous. A colonoscopy doesn't just detect cancer, it prevents cancer by removing these precancerous polyps before they can cause harm. After age 60, your risk increases significantly, but so does the effectiveness of screening. Studies show that regular colonoscopy screening reduces colon cancer death rates by up to 70%. The procedure has improved dramatically over the years. The preparation is easier, the sedation is more comfortable, and most people don't remember anything about the actual procedure. During the exam, your doctor can see the entire length of your colon and remove any polyps they find. If no polyps are discovered, you typically don't need another colonoscopy for 10 years. If polyps are found and removed, you might need more frequent screening, but you've likely prevented cancer from developing. Consider this. Colon cancer caught early has a 5-year survival rate of over 90%. Caught late, that drops to just 14%. The difference is often just scheduling that screening appointment. Diabetic screening becomes even more important after 60 because adult-onset diabetes can develop silently over years. Prediabetes, where your blood sugar is elevated but not yet diabetic, affects more than 1 in 3 adults over 60, yet 88% of people with prediabetes don't know they have it. This matters enormously because prediabetes significantly increases your risk of heart disease, stroke, and kidney problems, even if you never develop full diabetes. But caught early, prediabetes is completely reversible through lifestyle changes. The screening is straightforward. A fasting blood glucose test, an A1C test that shows your average blood sugar over the past 3 months, or a glucose tolerance test can all detect problems early. Normal fasting glucose should be under 100 milligrams per deciliter. Prediabetes is 100 to 125, and diabetes is 126 or higher. The A1C test is particularly useful because it doesn't require fasting. Normal is below 5.7%. Prediabetes is 5.7 to 6.4%, and diabetes is 6.5% or higher. If you catch prediabetes early, studies show that losing just 7% of your body weight and exercising moderately for 150 minutes per week can reduce your risk of developing diabetes by 58%. That's more effective than medication and comes with side effects like increased energy, better sleep, and improved mood. Thyroid function testing is often overlooked, but thyroid problems become much more common after 60 and can masquerade as normal aging. An underactive thyroid affects up to 20% of women over 60 and can cause fatigue, weight gain, depression, memory problems, and feeling cold all the time. The tricky part is that these symptoms develop so gradually that many people just assume they're getting older. An overactive thyroid is less common but can cause anxiety, rapid heartbeat, weight loss, and sleep problems that are often attributed to stress or other conditions. The simple blood test measures thyroid-stimulating hormone, or TSH, and sometimes additional thyroid hormones. Normal TSH levels are typically between 0.4 and 4.0. though some experts believe the upper limit should be lower for optimal health. If your thyroid is underactive, treatment with thyroid hormone replacement can restore your energy, help with weight management, and improve your overall quality of life within weeks. If it's overactive, treatments can prevent serious complications like heart rhythm problems and bone loss. Many people are amazed at how much better they feel once their thyroid levels are optimized. It's like getting a part of themselves back that they didn't realize they'd lost. Blood pressure monitoring takes on new urgency after 60 because high blood pressure becomes more common and more dangerous with age. Nearly half of adults over 60 have high blood pressure, but here's the concerning part. High blood pressure rarely causes symptoms until it's caused serious damage to your heart, brain, kidneys, or blood vessels. That's why it's called the silent killer. What makes this particularly important after 60 is that your blood vessels become less flexible with age, making you more susceptible to the damage that high blood pressure can cause. The good news is that blood pressure is one of the most treatable risk factors for heart disease and stroke. Regular monitoring means checking your blood pressure at least annually, but ideally more often. Normal blood pressure is less than 120 over 80. Elevated is 120 to 129 over less than 80. Stage 1 high blood pressure is 130 to 139 over 80 to 89. Stage 2 is 140 over 90 or higher. If you have high blood pressure, treatment can include lifestyle changes like reducing sodium, increasing physical activity, managing stress, and if needed, medications that can effectively control your blood pressure and dramatically reduce your risk of heart attack and stroke. The key is consistent monitoring so you can catch increases early and adjust treatment as needed. Finally, the most important test I promise to share is comprehensive metabolic panel testing, which gives you a complete picture of how your body's major systems are functioning. This single blood test measures kidney function, liver function, blood sugar, electrolyte balance, and protein levels. What makes this so valuable after 60 is that it can detect multiple problems early, often before they cause symptoms. Your liver can be struggling with medication processing, your kidneys might be showing early signs of decline, your blood sugar could be creeping up toward diabetes, or your protein levels might indicate nutritional problems or other health issues. This test should be done annually and compared to previous results to spot trends before they become problems. The beauty of the comprehensive metabolic panel is that it's inexpensive, widely available, and provides a wealth of information about your overall health status. Think of it as a report card for your body's major systems. When something starts to shift, you and your doctor can investigate further and take action early. Let me remind you of the most important message from everything we've discussed today. The absence of symptoms does not mean the absence of disease, especially as we age. Your body is remarkably good at compensating for problems until they become severe, but that doesn't mean you have to wait for symptoms to take action. These screening tests give you the power to stay ahead of health problems instead of chasing after them. Remember, catching these conditions early isn't just about adding years to your life, it's about adding life to your years. When you detect and treat problems early, you maintain your independence, your energy, and your ability to enjoy all the things that make life worth living. The beautiful truth is that your body has an incredible capacity to heal and improve when you give it the right support. Even if these tests reveal problems, finding them early means you have the most treatment options and the best chance for a full recovery. You're not powerless against aging, and you're certainly not alone in wanting to stay healthy and vibrant. Every small step you take toward proactive health care is an investment in your future self. If this information was helpful, please hit the like button and subscribe for more evidence-based health content designed specifically for people who want to age successfully. Ring the notification bell so you never miss important health updates. Most importantly, share this video with friends or family members who might benefit from this information. Sometimes the people we care about most are the ones who need a gentle nudge to prioritize their health. Leave a comment and let me know which of these screening tests surprised you the most, or tell me what other health topics you'd like me to cover. I read every comment, and your questions help me create content that truly serves your needs.